Go.
Knock, knock, knock. Hi there, I'm Anissa. I'm going to be your student nurse today. So I'm just going to provide some hand hygiene and privacy. So the reason that I'm here today is to do a head-to-toe assessment. So if at any point you have any questions, just feel free to let me know. Would you mind telling me your name and date of birth?
Kayla Bixler, 3/18/92.
Great, I'm just going to check that with your wristband here, and that matches. So I have a couple questions for you before we start. Do you know why you're here today?
I've got some rib pain.
Okay, sounds good. And do you know where you are?
Hospital, Minneapolis, Minnesota.
Okay, great. And then do you know the day of the week
Sunday,
and approximately the time of day?
about 8.
Perfect. So my patient is alert and oriented ×4. I'm going to start by taking some vital signs here. So I'm going to do a 2-step blood pressure. So that's within normal limits. It's about 120/80. Her respirations are about 12, between 12 and 20, and they are regular. Her heart rate is between 60 and 100, regular as well. Her oxygen saturation is above 95%, and then I'm taking an oral temperature as well, and that is no fever. She's got under 101.4. Are you experiencing any pain today?
I have a little pain in my ribs.
Okay, and can you describe that pain for me?
Kind of like a sharp pain right underneath one of my rib bones.
Is there anything that you do that makes that pain better or worse?
I kind of like when I put pressure on it.
Okay, and then would you also rate that pain on a scale from 1 to 10 for me?
About a 5 to 6.
Okay, sounds good. So I will let your physician know about that for sure. And then I am also just, right now I'm assessing overall skin tone. No lesions, no bruising. She looks well kept. She doesn't seem to show any signs of distress. Her posture is erect and appropriate. So I'm going to start by looking at your pupils here. So I am first looking, and they are equal and round. I am measuring them, and they're about a 4. So I'm going to come at you with a little bit of light, and it's not going to be too bright or anything. I'm coming twice. You can look actually straight towards me. Perfect. I'm going twice to make sure both sides are reacting here, which they are. I'm going to have you look in the corner of the room there, and then when I say, I'll have you look at the tip of my pen. Perfect, and they are accommodating. So I'm going to come at both sides, and when you see the pen, just let me know here.
See it?
Okay, and
See it.
perfect. So peripheral vision is good, and we're checking ocular motor here. So I'll have you follow the tip of my pen. And ocular motor is good as well. That looks great. So while I'm here as well, I'm going to have you open your mouth. And the mucous membranes are pink and moist in the nose and the mouth. And right here as well, I'm going to touch your skin with the back of my hands, and it is dry and warm and appropriate to ethnicity. Do you have any cultural preferences that I can take care of today as well?
But thank you for asking.
Thank you. So I am going to start by listening to your lung sounds today. So every time that I touch my stethoscope to your skin, I'm just going to have you take a deep breath in and out. And while we're here, I'll have you look head high up and chest out. So we are going above the clavicle here. I'm going inhale, exhale. And this is bronchial, vesicular, vesicular, and then we're going on the breast tissue here, vesicular and vesicular. So here, I'll have you come around, and then I'm going to have you go hands across the chest and lean over, and we're going to do the same thing. So every time that my stethoscope touches your back, we'll do the same thing. So we're doing inhale, exhale. This is bronchial, vesicular, 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 and we're going out wide vesicular as well, listening to the base of the lungs. And everything here is clear bilaterally. Now I'm going to be listening to your heart, so you don't have to worry about breaths. We're going to just be breathing normally here. So we're doing aortic, pulmonic, tricuspid, and mitral, bringing the breast there. Perfect, and everything is strong and regular. And then now I'm just inspecting your abdomen, and it looks symmetrical, so I'd be lifting her shirt up, and you don't have to, but I'd be lifting her shirt up. The skin, there's no lesions, there's no swelling or edema, and everything looks symmetrical there in terms of inspection, and symmetrical. So now I'm going to be auscultating. So I'm starting in the lower right quadrant. I'm listening in each of the 4 quadrants for 1 minute, and I'm looking for 5 to 30 regular sounds in each of the quadrants, which is great. So everything is regularly irregular there. Do you have any concerns about your digestion or bowel movements?
Nope.
And how often do you have a bowel movement?
Once a day, twice a day.
And can you describe the consistency of your bowel movement?
I would say it's got shapely, but it's not painful.
Okay. And then I'm also going to ask you about your urinary health. So do you have any burning, tingling, or odor when you urinate?
No.
Any concerns about sexual or reproductive health?
Nope.
Okay, sounds great. I'm also going to palpate here. So if you experience any pain, just let me know. So I'm gently palpating in each of the 4 quadrants, and everything feels good there. No masses, no swelling. There's no firmness or anything with that. So I'm gonna check your pulses here. I'm starting at temporal, so I'm doing these together. Doing one at a time for carotid, brachial, radial, femoral, which would be in the groin area, popliteal, posterior tibial, and pedal, and those are all strong, and they're also equal bilaterally, which is great. So I will have you come up on the side of the bed. You can stay seated. Do you feel dizzy at all?
No.
Okay, sounds great. So first I'm going to start by checking your capillary refill. So I'm squeezing on those nail beds, and they are returning in under 3 seconds. I'm going to do toes as well. Those are also under 3 seconds there. Perfect. And while I'm here, I'm also just assessing skin. So skin looks good, no lesions, and also still warm and appropriate to ethnicity. So I'm going to have you close your eyes. So I'm swiping here. Do you feel that?
Yep.
And I'm swiping here. On either side, did you feel pain, tingling, or numbness?
Nope.
And I'm going low and low. Did you feel that on both sides?
Nope. Yeah. Oh yes, I felt it. Yeah.
Okay, perfect. Any pain, numbness, or tingling?
No.
Okay, sounds good. So you can open your eyes again. I'm gonna have you go squeeze my fingers. Okay, and that's a +5 bilaterally. We're gonna push up. Perfect. Push down, out. So +5 with that as well. I'm gonna do the same thing with the feet. Push it up and down. Perfect. Into the side. Perfect. And that's +5 bilaterally as well. So here I will have you stand up if you can. Do you feel dizzy at all?
No.
Great. So in a moment I'm gonna have you close your eyes and lift your palms up for 30 seconds. And so I'll have you turn just a little bit here. Perfect. So you can close your eyes. We'll do that now. Awesome. So there's no dripping or sagging to either side. So that looks great. And here I'll have you open your eyes. Doing great. So you can kind of repeat after me. We're checking coordination here. We're just going back and forth, and coordination looks great. Awesome. So here I'm going to have you walk to the doorway. Just normal gait. And normal gait looks perfect. No drooping. There's no limping or sagging to one side or the other. Yeah. Okay. Wonderful. I think that's all I've got for you today. Do you have any questions for me?
No. Thank you very much.
Thank you so much. So I'm going to document my findings. I'm going to perform hand hygiene, and that's all.